Listen to this podcast now
on the Red Apple Podcast Network.
The Idea Gen Global Podcast with George Sifakis.
I'm George Sifakis. In a world overflowing with noise, there is one forum where the world's smartest voices connect, where visionaries sit at the same table as innovators, and great minds don't just talk, they act.
Download all of Red Apple Media's podcasts right now through your favorite podcast platform.
Sunday morning, Dr. Peter Michalos. Well, live long and prosper. And, doctor, there's so much science moving along so fast, I don't know where to start. Where do we start this Sunday morning?
Well, today, John, we're going to talk about a very interesting topic that it's estimated that 133 million Americans deal with every day in some form or another, and that's called inflammation, also referred to as inflammaging. You know, some inflammation is good for us because it actually helps us fight off viruses, bacteria, infection. The problem is when inflammation becomes chronic and is very intense in high levels, it does damage, and it's referred to by some as the silent fire in our bodies. And it's an immune aging process. It weakens our immune system, and it's like a smoldering log inside your fireplace. The fire goes out, but it continues to smolder continuously for a long. And the dangers of ongoing chronic inflammation is it turns out that it triggers heart disease, which is the number one killer of Americans. Then there's cancer that it helps trigger. It's thought to trigger diabetes. All the different bowel diseases are associated with inflammation. And one of the more serious ones is the neuroinflammation or cognitive decline, like Alzheimer's. And a recent publication in July 25 in the prestigious Nature Communications showed that the title was Accelerated Brain Aging During COVID-19. And they looked at scans of 15,334 participants, and it turned out that it accelerates aging, and it actually affects men more than women. And it turns out that just a single infection from COVID-19 flips our inflammatory system into overdrive. And COVID-19 also causes inflammation. A bunch of people have it who we know who've had heart inflammation, and they end up with shortness of breath, palpitations, rapid heartbeat, and it even goes up the nose, as you talked about once, and it damages the cells of smell in the nose, the olfactory system, and that can be ongoing damage that has lasted continuously since the time of COVID for some people. And the researchers in Australia found this that the brain inflammation that it causes it looks similar to Parkinson's on the imaging. Some of the tests you can do to see if you have inflammation in your body is the ESR, which is the sedimentation rate, and when that's elevated, it's a sign of inflammation. Homocysteine is an amino acid marker that also, if it's elevated, is a sign of inflammation. The C-reactive protein, specifically the highly sensitive C-reactive protein called CRP, is also a marker of elevated inflammation. Another one is TNF-alpha, tumor necrosis factor, another marker of inflammation. And, of course, good old uric acid levels, which are seen in gout, and that's associated with inflammation. And that's why during COVID, some doctors, especially in Greece, they were using a lot of colchicine to stop the inflammation. And also some people laughed when people talked about hydroxychloroquine during COVID, but it turns out now that they look back at all the studies, when given consistently and early, it does block the cytokine storm and inflammation of COVID. So things you can do to reduce the inflammation are eating things with fish that have omega-3 acids, like take an omega-3 acid supplement. Curcumin from the turmeric root inhibits inflammation pathways. It's a natural way. Resveratrol that's found in red wine, berries, blocks inflammation at the cellular level, and that exists as a supplement. Ginger root also is anti-inflammatory. Of course, green tea extract, especially the powder, the green tea matcha powder, which I try to have one every day, is also very anti-inflammatory. And quercetin, found in apples, onions, and capers, it also stabilizes cells that release histamine and other inflammatory mediators. So there are things that you can do. And of course, we talk about olive oil and having some salads and a good piece of fish. Those are things that are low inflammation.
So it comes down to all of our creators' doings, natural foods. If we use them all in moderation, then it helps. It helps have a healthier body.
Yeah, it does. You have better health, better inflammation, and then on the other hand, you have things that I say are like gasoline in the fire of inflammation, like all the seed oils. We've talked about the vegetable oils, the canola oils, the cottonseed oils, which are made from industrial chemicals, and they actually turn on the inflammation. Processed meat, deli meat, are not good. Having a good regular steak that would be good, preferably from grass-fed cows, that would be a better option. And we saw the food curve has been inverted, that it's okay in moderation. And the other thing that we have to add with this inflammation and the COVID is that an Irish study at the Royal College of Medicine in Ireland found that the spike protein from COVID turns on the clotting system, and that's probably the reason that people who have COVID and people who are exposed to this spike protein consistently get more clots, and that might explain why we're seeing more heart attacks, strokes, and clots after COVID. And there's also a blood test after COVID to see about your clotting system if it's in overdrive, and that's called the D-dimer. And when your D-dimer is elevated, one of the tests they do.
And does that have to do with people having a problem after getting that vaccine? What do you call that vaccine without naming a brand name? The COVID vaccine?
mRNA. The jury isn't out yet with the details, but the studies show that when you constantly see the spike, your immune system, it activates the clotting system. And they definitely know that from COVID, getting COVID.
Is there a test for that?
Well, you can test just to do antibodies against COVID to see what your titers are. If they're super high, you probably have a lot of spikes in your body if your levels are super high. And you can also do the D-dimer test to see whether your clotting system is in overdrive. So that is another test that's done routinely, especially when you get admitted to the hospital with COVID. And that's why early on they found out that giving anticoagulants, and the doctors who figured that out early, who gave anticoagulants, who gave the prednisone, who gave the hydroxychloroquine, those patients turned out to do much better. The trick was to give it early and consistently, especially the blood clotting drops. And Dr. Dostiopoulos from Stony Brook, the chairman of vascular surgery and general surgery, wrote one of the first papers on that about giving anticoagulants to COVID patients, and that improved outcomes. So we now know more about inflammation, and we have to do our best. If you get COVID, please get tested quickly. Take an oral antiviral right away to block the viral replication, so you're less likely to end up with long-haul COVID.
Thank you so much, Dr. Peter Michalos, and thank you for keeping our listeners living longer.
Thank you, John, for always giving us the microphone to get the truth out about medicine and keeping people to live long and prosper.
Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. Just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.